Hi, and welcome back. Okay, let's finish up our radiology section. Hopefully that you read in your textbook about your technical and professional components. Your technical components are the ones for the use of the X-ray machine, the X-ray technology, X-ray tech that takes the actual films, and anything that it takes to produce those films. The professional component is the one where the actual radiologist reads the X-ray, interprets it, and makes a report. The one thing you need to remember in radiology is that all of the codes are based on a global service, and the only time that you would add a technical component modifier TC or professional component modifier 26 is when the procedure is split, and the X-ray may have been taken in one place and it may be read by a physician in another place. Okay, so your radiology specialties, you have interventional radiology. It's when actually radiologists can go in and try and treat a problem using their radiology techniques that they've learned, like clearing arteries or veins. You have your radiation oncology, which we've already talked about. Those radiation oncologists, boy, I tell you what, they develop the treatment planning and delivery methods of patients that are being treated for malignant neoplasms. They have the stereotactic radiation, the radiation treatment, neutron beam treatment, and brachytherapy are just a few of the things that they can do. And also radiologists can specialize in nuclear medicine. Okay, so where and how do you start? Well, first you need to learn the radiology subsections. Then you need to determine the type of service, which is called the modality that's being performed. You need to locate the anatomic site, and then you need to just distinguish the use of contrast material and whether any was used or not. Okay, we're just going to walk through a quick example. So let's take a brain MRI. First, you'd start in your index and you would look up MRI. You would find when you looked up MRI, it would say see magnetic resonance imaging. So you'd go to magnetic resonance imaging, and underneath that heading, you would find brain, and you'd find the code 70551 to 555, and under that indented further would be intraoperative 70557 to 70559. So you'd go back to your radiology subsection in your book, and you start by looking up code 70551. What you would see is magnetic resonance imaging brain, including brainstem. There's your semicolon without contrast material. 70552 then would be indented. Remember, you take everything in front of the semicolon and then add what would be left, which would be with contrast materials. And under 70553, you would have it also further indented, and it would say without contrast material followed by contrast material and further sequencing. So if your physician orders an MRI of the brain with and without contrast, you would actually use the 70553 because that would specify both with and without contrast. Okay, but we have one other little piece that you need to remember to look at. That would be your code 70557 to 559, which was also referenced in your index. So what you need to do is interpret the difference between these codes and the 70551 to 70553. When you read in your chapter underneath the heading, that's where you have to make sure that you know the importance of reading all the words that are included in the description. So under the 557 to 559 codes, it says during an open intracranial procedure, for example, to assess for residual tumor or residual vascular malformation. So in essence, the codes are really identical, the whole set of 6, except for one is being used during a surgery. So that does it. That wraps it up on coding. I hope this little example helps you, but always remember to read everything that you need to read within the framework of a code so you make sure you get the right one. Okay, happy coding!